Hey everyone, this is Rinku, your pharmacology guide. So let us start with the very first topic, general pharmacology and its terms. There you are. Yes, the very first word is pharmacology. As you all can see, it is made up of two words. The first is pharmacon, that is drugs, and logy, that means study. So read it together, study of drugs. Yes, there you are. Now, so let us define this in a particular way. So we can say the definition of pharmacology as it is a science that deals with drugs. Yes, again, it is a science which deals with drugs. So now let us move to the word drug. Any substance used to diagnose, cure or prevent a disease is nothing but drug. So we know about the drug. Yes, so let us now go through various terms, that is diagnose, cure and prevent. What that means? Cure means to make somebody healthy again after he or she had an illness. Diagnose means to find where a person has some ailments or a disease like that. So that is diagnose, to find. And prevent is to stop something from happening. In this case, it is an illness. So that is prevention, and these all three terms are related to drugs. So please keep this in mind. This all three terms, diagnose, cure, prevent, is related to drug. Let us move ahead with the 6 main divisions of pharmacology. And there they are. First one is pharmacodynamics. Again, it is two words, pharmacon and dynamics. You should have a habit to break the words and remember things. In science, there are many words that you can break and then remember its perfect definition or the meaning. So, in this case, pharmacodynamics, this deals with biochemicals, physiological effects of drugs and also their mechanism. So let us just know the meaning of biochemical. Yeah, so what is biochemical? It is bio and chemical. Again, two words, living, bio is living, and chemicals. So let us start. Chemical reactions that takes place in a living cell or a living body is known as biochemical. And the other thing is physiological. That is the effect of drug on our body. And mechanism is the binding of drug to our body receptors. Yes, we do have receptors. And can you guess what is that receptor? So that is, example is enzyme. In our body, enzyme acts as a very good receptor for the drug. And hence we get cured of that particular illness or a disease. Let us say this pharmacodynamic in a simple line, simple way. In simple sense, it is effect of drug on body. That's it. Pharmacodynamics in simple way is effect of drug on body. Let us move to pharmacokinetics. This deals with absorption, distribution, metabolism and excretion of drug. Now absorption, as we have to take in the drug, it should be absorbed so that we will have the effect of that drug. We will have the benefit of that drug. So absorption, distribution is must. And in the same way, metabolism, that drug should be metabolized. That means drugs should be broken down into pieces and fine particles to reach each and every part wherever it is required. But wherever there is affected part in our body, there the drug should be reaching. For that purpose, metabolism is required. And excretion, yes, of course excretion, because if there is unused drug in our body, so it can lead to harmful effects. Yes, harmful effects. Therefore, excretion is a must process. So, excretion of drug. This comes in pharmacokinetics. Pharmacokinetics can also be said in a very simple line, and that is what body does to drug. That means what our body does with the drug. That is pharmacokinetics. And pharmacodynamic was what the drug do on our body. Both are opposites. Now let us move ahead. Therapeutics. Therapeutics is just so simple as the name. Therapeutics, therapy. That means deals with use of drug for curing any kind of disease. Yeah, any kind. So that is therapeutics. Let us move ahead. Yes. Clinical pharmacology. It includes all aspects in relation. We can say drug and human relation are studied in clinical pharmacology. In simple term, we should understand and remember it is relationship between drug and humans. That's it. And then next is chemotherapy. Here as the name again too, chemotherapy. So chemo is chemical, therapy is treatment. So here chemicals are being used as treatment, to give treatment. And the most latest example we all know is cancer. In cancer, doctors use chemotherapy to treat cancer patients. So, chemical therapy given to destroy rapidly growing cells in the body is nothing but chemotherapy. The next is toxicology. Yeah, toxicology. As the name, toxicology, toxic. That means very fatal, death-causing, very harmful. So toxicology, so study of toxic or poisonous effects of drug in our body. So that is toxicology. It deals with poisonous effects of drugs, detection of poisoning and its treatment. So this field is known as toxicology or toxicological studies. So hope you guys understood this pharmacological terms. Thank you. Let us stop here. Take care. Bye-bye. Hey guys, if you liked our video, please do like, share and subscribe. And please press the notification bell icon so that you can get the latest updates.